A story that came to me, and it's a little bothersome to an extent that you are involved, or your wife is involved, a girlfriend is involved in the world of breast implants. Many, many, many women are, whether they tell you or not. There is a story that came out from the New York Times that 9 deaths are now linked to a rare cancer from breast implants that have to do with textured implants. Now, there's some implants that have a very smooth surface, not the textured kind. They're more pebbly. They look like tiny, tiny, tiny little pebbles than a smooth implant. And that is what this rare cancer is connected with. So ladies and gents, listen up. On the air with us, I'm going to bring her up in just a moment, is Dr. Farah Khan. She is with Khan Plastic Surgery out in the Dallas, Plano area. She knows a great deal about this, has dealt with this. Welcome to the program, Dr. Khan. Hello.
Hi. Thank you for having me.
Nice to have you. Can you turn her mic up a little bit so I can hear? Thank you. All right. Dr. Khan, I'm intrigued by this. I don't want to worry our audience, but I thought it would be worth having you on the air to talk about how 9 deaths are now linked to a rare cancer from breast implants. This, the first link was in 2011, but now there's 9 deaths. This news came out in March of this year, and the Food and Drug Administration did confirm it. It all has to do with whether or not a woman has had a textured implant, which is more rough on the surface. The New York Times describes it as pebbly surface. I would just say more rough, as opposed to a smooth implant. And if I understand it right, correct me if I'm wrong, the reason for using a textured implant is that the implant won't move around as much. It stays in place. True?
Yeah, so I think that was the reason why they were initially developed, because the thinking is when an implant is textured, the body's natural tissues would kind of grow into it, and so it would adhere more strongly or more firmly to the overlying tissues.
Okay, and so do you do a lot of these, or are you more inclined to put a smooth implant in when a woman comes in for plastic surgery to get her breasts nicer looking, whether it's large size or maybe she's had a mastectomy, whatever?
Sure. I honestly only use smooth silicone breast implants. I would say textured implants are relatively rare. I mean, the ESPS, which is our professional society, it estimates that about 300,000 women every year undergo breast implants for breast augmentation, and then another 100,000 women undergo breast reconstruction using implants. Only about 12-13% of those implants are really textured. Mm-hmm. So it's a relatively small number when you look at the big scheme of things. But like you said, it is a little bit worrisome. Initially in 2011, that's when they first suspected that there was a link between implants and ALCL, or this type of lymphoma, and then the FDA created a registry. And so earlier this year, it was the first time they were able to do an update. And so by this point now, they have over 350 cases, 9 deaths, and the majority of the cases said that they were linked to textured implants.
Well, all right. You say on balance, the textured is used less. You use the smooth in your practice, and yet the deaths are mounting. So what is it exactly? I read, and, I'm trying to sort through some of the heavy medical stuff on this. So, again, correct me if I'm wrong, Dr. Khan, but I'm reading that once that textured implant is in the breast and it adheres better, so the silicone or the saline doesn't wobble around a lot, and I mean it's solidified into the chest better. But nonetheless, it seemed to be an irritant connected with a blood disease, some kind of lymphoma, whereby the cancer starts in the skin tissue. Right directly agitated, it seems, with the textured implant. Do I have that right?
You do. It's typically, whenever you put a foreign object in the body, the body responds by making scar tissue, and the body essentially walls it off. So whether you have a knee implant, you could have a hip implant, you could have a breast implant, the body responds the same. It walls it off.
Mm-hmm.
And so in the case of implants, we call it, and actually we call it, whether it was a knee implant or a hip implant, we would call it a capsule. And so typically the cancer cells that are indicative of lymphoma are actually found in that capsule, or they're found in between the capsule and the implant in some fluid.
Mm-hmm.
And so it's a very well defined and kind of, it's located in a place that is relatively easy to find. If a woman does complain of swelling or pain, you can go in and typically surgically excise the entire cancer.
All right. So it seems to me that I understand it better. It's this irritant in the skin, in the tissue. And it seems to me, now, again, I'm not sure about this, but from first read, that this is a fast-moving cancer. And when you've got the first one associated with this rare lymphoma in 2011, and now 9 deaths are absolutely certain to it, that seems pretty fast-moving for something that's used not very often. Would you agree?
Well, 2011 was when the FDA initially said, let's make a registry to try to learn more about this cancer, because we honestly really didn't know. And so I'm sure there were women way before 2011 who probably experienced this lymphoma, and we as physicians probably just didn't know, what it was linked to.
Mm.
So I don't necessarily think 2011 was, when it was first discovered. It's probably been going on for a while. Typically, it doesn't necessarily present right away. It actually presents years after women undergo implant placement. And so the average patient might have had implants for 5 or 10 years before she would start noticing pain and swelling. So it's actually relatively slow growing. And, even though the FDA now knows that there were 9 deaths, who knows, there may be slightly more, just because the registry is, completely voluntary. I mean, physicians are pretty much urged to just, as soon as they see a case, to kind of enter in the case. But there are some duplicates. So some of the numbers are not completely accurate.
Mm-hmm. Do you have any sense of why this matters, causing this cancer?
Well, there's a couple of different theories. They think, it could just be the actual processing of the texture itself, which for some reason might cause a lot of inflammation in the body when the implant is put in, and that may lead to the body's immune system kind of, becoming super hyper and almost creating this cancer.
Mm-hmm.
Some people think it's a biofilm.
A what? What did you say? A bio what?
So it's called a biofilm, FILM.
Mm-hmm.
So what they think is the bacteria essentially lodge themselves within the grooves, and you mentioned it's kind of like a pebbly surface, and so it's easier for them to kind of lodge themselves in. And so some people believe it might be, due to the biofilm, the infectious nature might be, predisposing these women towards forming this kind of inflammatory response that then leads to cancer. So right now there's a bunch of research going on to try to figure out what exactly is causing it. I think right now the FDA's main goal initially was just to figure out, okay, how many women have been affected by this and what do we know? So at least from 2011 to now, we do know that, okay, it is a real occurrence. It isn't just, a sporadic occurrence.
Right.
And we also know that it's primarily located to textured implants, which honestly, as I said before, is a pretty small number.
Have you ever done them? Have you ever put in a textured? A woman comes in and says, I don't want my silicone gel flopping around. I don't want saline flopping around. I want this textured. And you say, well, okay, surgery's next Wednesday.
Well, I don't. I don't use them. It's just, I think if a, patient did ask, I think I'd probably explain to her the risk. And, at the end of the day, I think the reason why I'm a plastic surgeon is because I did get through 8 years of training. I went through my boards. I mean, I should be able to advise my patients as to what is, good for them.
Well, shouldn't it be banned then, Dr. Khan?
Well, I think right now, like I said, right now, the FDA was just trying to gather kind of the initial information. So now that they have the initial information, they're now kind of leading studies all over the country, just trying to figure out what exactly is the process that's leading to it. And I think once they can figure that out, then if it really is the texture, then they probably would ban it. But if it isn't, if it's the biofilm or whatever, it may just need to be modified.
All right.
So I think it's one of those things. We just need to find out more of why exactly this is happening.
Understand. Quick break. Dr. Farah Khan Plastic Surgery out in the Dallas-Plano area. We're back on the program, and I want to thank Dr. Farah Khan very much for spending a little time with us. I know it's a little later now in Dallas, but we got some news that the FDA has updated the warning on the link between textured breast implants and a rare cancer. At the break, Dr. Khan, I got an email from a Becky. Terry, I've been listening to your show. I have saline in my breast. They don't stay in place. I have considered taking them out, getting with my plastic surgeon, and going the textured route until your show. Now I don't know what to do. Please help. Thank you, Becky, for the email. Dr. Khan, what do you say to that?
Sure. Well, what I would say is, you don't necessarily have to change over to textured implants. In fact, I never use textured implants. The key is finding a board-certified plastic surgeon who, in the first place, makes your breast pocket the actual size of the implant, right? So if it's actually made, if it stays within the anatomic boundaries of the breast, then you probably wouldn't have those issues, right? You wouldn't have the issue of the implant sliding down onto your chest or down onto the abdomen or sliding kind of into the armpit area. Now, the problem is if you've already had it dissected and now, you are having those issues, you can still correct it, but the breast revision surgery is going to probably require, a little bit more extensive surgery. It might be two-staged. We, as plastic surgeons, we can typically close off the pocket where it's too big. And then we can just put in a smaller implant, and we can still use a smooth either saline or silicone, whatever the patient wants. But there are ways of getting around that. Textured implants, even though that was the thinking, first off, textured implants are very firm. So typically most women don't like that feel because they don't really feel like a real breast. The smoother ones are much softer, and so they feel more natural. So I would say, there's multiple options out there. You don't have to just think that, you have to get it textured in order for it to stay in place. It's not true.
I was just thinking, too, people think, well, some of your questioning would go to the fact that, Terry, you don't have implants, and to be sure, I don't. So if it sounds a little sophomoric, that's why. All right. When I booked you for the show, I asked you about. So we'll switch gears in the limited time that we have, Dr. Khan. I asked you a little bit about the rise in teens having plastic surgery. We talked a little bit about that on another show that you came on, one of my other shows, and also when I booked you for the show. Do you have any comments on that? I know there is a rise with teens' interest in plastic surgery, which I think is pretty dangerous. I don't think teens should be messing around that way. And you want to start doing some plastic surgery, wait until you're older. But that's probably the old-fashioned mom in me. There's a lot of reasons why people would seek out a professional like yourself. What do you comment about teens and their interest in it, and then those who actually go under the knife? I see where it is rising.
Yeah, my feeling is, first off, you need to figure out what is that teenager's motivation. Why exactly do they want plastic surgery? And I think, most patients, if you spend enough time with them, they will reveal their motivation. And if it's because they're being bullied at school or they want to fit in, obviously plastic surgery isn't going to help. So, those are the types of patients that need to be referred for other, they need other types of help. If it's someone who has thought long and hard and seems to have the correct motivation, understands the recovery process, because again, it isn't just like, plastic surgery isn't magic, because once we do the surgery, then there's a good recuperating time period. And recovery often can take a good 6 months to a year for you to see your final results. And so you need to be able to understand and process all of that. And I think, there are certain patients. I've had a patient, she was 17 years old, and she had extremely large breasts, and she was very thin. But unfortunately, her breast size was so large that she would wear like a size 14 on top and then a size 2 on the bottom.
So it was disproportional.
Exactly. So completely disproportional. And she just felt bad because she couldn't wear, the clothes that her friends were wearing. She wanted to go to prom, but she couldn't get a strapless dress. And so I talked to her mom, and we did a breast reduction, and she was very happy, and then she actually sent me photos from her prom. So there are certain patients who are, they are fine for plastic surgery, but I think the goal of the plastic surgeon really should be to kind of delve a little bit deeper and figure out what is that teenager's motivation.
Do you see it more with teens with their face, or do you see it more with breast reduction or liposuction? Where is the interest with teens these days with regard to plastic surgery? We're down to a minute.
Sure. I would say majority of girls are typically interested in like a breast reduction.
Oh, I see.
Or if they're asymmetric, they just want to look more symmetric. And then a lot of the boys though will come in for if they have like really prominent ears, that really bothers them, and then also nose jobs.
Yeah, I would have guessed nose jobs. I would have guessed that. And, I also would have guessed that a lot of teens don't want their friends to know they've had it, but there's hardly getting around that with, you get a nose job, you got a lot of swelling, you got a lot of puffiness in the face, you've got all of the redness that comes with all of the blood, that, all of that. And so I suppose the downtime, you can't really sort of hide the downtime. Surgery is surgery after all.
Exactly.
Yeah.
And they need to understand that.
Yeah.
That's the key.
All right. We need to leave it there. Final thoughts. We're down to about 20 seconds.
The final thoughts. Well, I just want to make sure that majority, women, they shouldn't panic if they have implants. And the FDA said the same thing. There's no widespread panic. This is just something that we're investigating, and we're trying to find out and kind of get to the bottom of why do these implants seem to have a correlation with ALCL. So, no widespread panic. Majority of women should, continue with their routine kind of breast exams, continue with follow-up with their plastic surgeons, and you should be fine.
No panic, but I'm glad you gave us the up close and personal, by coming on the air, review of this rare cancer with regard to textured implants. Dr. Farah Khan, thank you very much for coming on the program. You can find her out there in the Dallas-Plano area.